Oh my gosh, I got this too. What the heck?
I just told you don't listen.
Well, I thought you got this during UIL.
Oh.
Okay.
I wasn't here.
Let's try this again. Anemia. Excuse me. 3 main causes of anemia. 1, excessive blood loss. So maybe you get injured, whatever. There could be lots of things, but injury, surgery, internal injury, excessive blood loss. 2, second main cause is a decreased red blood cell production. And we're going to talk a little bit more about some of these. Decreased red blood cell production. And then the third main cause is an increased rate of red blood cell destruction. So they're breaking down too fast.
Are you sure this is where we are?
We're on 10.3.
10.3.
What? Did I miss 10.2?
Blood tapping. We did blood tapping. We did the lab.
What
Same
day?
day. Maybe.
Oh.
Good diet, things to make sure to include in your diet so you don't have anemia is iron. I know that. That's what they always ask for about the blood drive, right?
Mm-hmm.
Another one is folic acid. That's particularly important during pregnancy. And then the other one is vitamin B. All this is good for red blood cell production and to keep your blood cells carrying oxygen the way that they need to. So, virtually here is what you're looking at. Decrease of our red blood cells, like we said. Not enough hemoglobin is another type of anemia. So, if there's something going on with your hemoglobin, what does your hemoglobin do?
Carries oxygen.
Carries oxygen. So, if you don't have enough, then your body's going to think, oh, we need more, right? Even though it's not working the way it needs to. So you can have acquired anemias or inherited. Acquired means that you have picked it up somehow. Maybe it's related to your diet. There's something that's happened to you or you've done something to get it. Inherited means that you're born with it. So first acquired anemia is iron deficiency anemia. This one's pretty simple. You add iron to your diet.
My mom has iron deficiency.
A lot of people have this. This is another really common one during pregnancy too. Insufficient dietary intake. Sometimes it's not even the diet. It's not that you don't have enough. It's that your body's not like processing it like it needs to. Or it could be that one thing is if you take iron with calcium, calcium binds up the iron and you can't absorb it. So in theory, you see these cereal boxes, right? And they say iron fortified cereal on them. But if you eat those with milk, it has lots of calcium, you're not actually getting a lot of the iron that is not available because the calcium binds it up. So dry cereal sometimes is better if you're trying to take it to increase your iron. Dry cereal is better.
He said drink it with.
No, I haven't done very good this pregnancy, but normally I eat like dry, shredded mini wheats and stuff.
I forgot you were pregnant.
Bleeding from intestinal worms is another way to get iron deficiency anemia. That is probably the most common worldwide, is because of worms. Now,
That's the most
in
common.
the U.S., worldwide it is, not in the U.S. The U.S., worms are not that common, so, and people get them, but it's not as common as it is in other places. I remember my mom always talking about the sandbox, like wanting to keep the sandbox covered because animals would come pee and poop in the sandbox, and they have worms, and then you get worms when you play in it.
Yeah, I never played the same box.
What's your not on sandbox? Wow. Yeah. Still think more on that.
I'm gonna check it.
What is prevailing?
I mean,
Two sandbox.
This is like
And then
administrative.
just give them
You can't
one.
be finding word using the word
Exactly.
to define.
What's prevalent mean? Is Cody over here playing and stuff?
Prevalent.
Cody, just hush. Anyways, Miss Bird,
Prevalent.
Cause this question,
Sorry, that was
it's real.
I don't know what that is.
It's part of this.
What?
I said, what's the most common type of anemia?
Oh.
And then I put the one we were just on, and then it says how prevalent is it? So-
Prevalent.
Okay, Cody, I don't know the word.
I didn't write that down in my notes. Aplastic anemia. So this results as this is a result of damage to stem cells in the bone marrow. So this is something that might come along with cancer. Somebody takes chemo or has radiation treatments that damages their bone marrow, and they get aplastic anemia. So any kind of toxins, and chemotherapy, it really is toxin. And it's very intense drugs. Infectious disease could cause it, or heredity. They have some kind of bone marrow issue. Pernicious anemia, this is where your intestine can't absorb vitamin B12. You ever had a family member or anybody have B12 shots?
I've seen someone have to get that.
It looks like Kool-Aid.
Yeah.
Yeah, it's like bright red. It looks like red water. I mean, it's like not like blood. It's like see-through, like Kool-Aid.
Ew.
What is it?
I remember the first time I saw it, I was like, I'm not injecting this into someone. This does not look safe. Like, it's for pernicious anemia, B12 shots. I get them like once a month. Some people, you can take B12 supplements, but if your B12 is low because your intestines won't absorb it, I don't know why pills would work. That doesn't really make sense.
Yeah.
And then there's other anemias caused by chronic disease, like rheumatoid arthritis can cause it because it affects the joints, especially kidney disease. Why would kidney disease cause anemia?
Because it filters down how we
It does do that, but what do your kidneys produce that has to do with blood production? Do I remember this? I think we studied it in the endocrine chapter. And it starts with the E.
Endorphins.
Here, those are from the endocrine chapter, though. I will give you that. And they start with the E.
Mm-hmm.
Your kidneys, when your blood is not making enough oxygen, your brain sends a message to your kidneys and tells it to produce erythropoietin. Remember that word? How do you not remember that word? We talked about it in the endocrine chapter, and we talked about it last week.
I remember the word, not what it means.
So erythropoietin is a hormone that the kidney puts out, and its effect is on the bone marrow. So it causes the bone marrow to start producing red blood cells. Erythro, remember, means red. You know, it's always red, so red cells. So erythropoietin is a hormone from the kidneys. Brain signals to the kidneys to make some more, that we need more oxygen. So the kidneys say, okay, we'll make some more red blood cells. Sends that erythropoietin to the bone marrow. Bone marrow starts making more red blood cells.
So
So if you have kidney disease, then your kidneys are not sending out erythropoietin, which is not ever, so your bone marrow is not ever getting the message about making more red blood cells. Make sense?
that's
Chronic infections could cause anemia, and then cancer, of course, is another one. Inherited anemias include, probably the most prevalent one, or the one you've heard the most about, is sickle cell anemia.
Mm-hmm.
So that was on the video. Did you watch the video last week?
Yes.
It's like a blood video. It was a lot about sickle cell. What was something interesting y'all learned about sickle cell? What are people with sickle cell immune to? Okay, Stat.
video.
I didn't watch no video.
I didn't either.
You said they did
There's
watch
a
it.
really good video. Maybe I didn't
What
put
day
it
did
in
you
there.
watch it?
Yeah, wait.
Maybe I didn't put it in there this time.
I mean, it
I
was,
thought I did.
it was Monday
I know I forget
or
sometimes.
Tuesday. I didn't watch it.
Maybe we did.
It was Thursday.
Well, we didn't do anything.
Oh,
Yeah,
yeah.
it was gone for
Oh,
UIL.
so anyway, it's a really good video talks about sickle cell anemia. But if someone has the sickle cell trait, and it's hereditary, so something that you're born with, and you can have it's recessive, so that means you have to get traits from both your parents in order to actually have the symptoms. Have sickle cell, but you can carry the trait, without exhibiting symptoms because it's recessive. Does that make sense? So people who have the sickle cell trait are immune to malaria. So if you have sickle cell, you're definitely immune to malaria, but also if you just carry the trait, you're immune to malaria. Isn't that
So
crazy?
you'd be good if you went to Africa or something.
So
Yeah,
would you have to get
take
the
any
shot?
medicine.
You wouldn't have to do.
I wish that was the case. I don't think they have shots for malaria, do they?
Oh, I don't know.
Unless it's
I just know y'all have to get shots.
You die if you get malaria?
No, no, you can get chronic malaria where you have it forever, but no, usually you can just take medicine and it goes away. But so sickle cell anemia is where red blood cells, your body goes into this like sickling crisis, and all of a sudden your body will start making like mass amounts of these sickled cells. So instead of being shaped like a donut, and they're actually shaped more like this, like a sickle, like that bottom picture.
Like the hammer, like you use it for cutting.
Yes, that's what it's shaped for. So what are some problems you foresee with that?
Not being able to go through well. Fit there.
Can't fit through the capillaries, right? So it causes clotting. It's a big issue, and lots and lots and lots of pain.
Can it not carry oxygen?
Doesn't carry very much oxygen
Blocks
either.
the blood flow.
So usually you check their O2 stats and they're low. Usually lots of pain. And there's no cure for sickle cell. I mean, there's nothing you can do about it except for treat it when they go into crises.
For like blood thinners?
No, not blood thinner, but they actually get whole blood. So like when this I had kids all the time at Children's who would come in within a sickle cell crisis. And yeah, usually, unless there's something new that they're doing, usually give them blood. Because what that does is that increases their blood volume, which dilutes the blood and dilutes those cells.
Or what about the clots?
Well, a lot of them will move on. If there's enough blood, enough of the other cells will help them move on through. But that's pretty much all. There's not a whole lot you can do. Pain medicine and, blood transfusion. But there's nothing long term. Cooley's anemia was where you can't produce fully formed hemoglobin, and so you're not making enough red blood cells. Plus, they're not carrying oxygen. So lots of issues. Are actually read in here. Where did they go? Says that they require frequent blood transfusions, but they can be really dangerous because that can make their iron go up too high, and then that causes damage. They have too much iron.
It's already too
Says that iron accumulation leads to heart attack and death in 50% of the people with Cooley's anemia before they reach 35.
Oh my goodness. That's so young.
So they use, it says chelation therapy, which is where they get rid of the metals in your blood.
I'm already 34. Oh wait, what did she say? 25?
It's like after they fix one problem, it can cause another problem.
Yes.
They have to fix
And
that.
that's a lot of things is you take the medicine to fix one problem, but the medicine causes its own set of problems. And that's, yeah. So, anyway. Says in the case of iron poisoning, so if you get way too much, or your body's not getting rid of it like it needs to, the chelating drug binds with the iron and prepares it for elimination from the body in the urine. That's how they get rid of it. Nasty. Okay, jaundice is a blood disorder characterized by yellow-colored skin, especially the whites of the eyes. You see lots of yellow. I remember when my sister had her
What about like the red?
gallbladder. No, not redness. This is like yellow. Like the whites of your eyes look kind of like pale yellow.
What's it called when like the whites of your eyes are blue? Or like a pale blue?
I don't know.
Is that real?
Might be like more of an anemia issue. I don't know.
Because I've seen that on people before. They have like faint blue.
Jaundice or yellow says it's caused by an excess of bilirubin, which is a product. So when your red blood cells break down or destroyed, bilirubin is a waste product of that. So because normally your liver will remove that, but for newborns, especially, you often see jaundice with newborns, especially premature newborns, they their skin will look real yellow because their liver it's not developed enough to actually remove all of that out of the bloodstream yet.
So what happens?
They put them under, if it's bad enough, they put them under these Billy lights, and they're like a UV light, and you can take them home, and they have them at home, or they put them, we used to have Billy blankets, and kind of like a heated air blanket that had UV lights in it, and that helps to get rid of that extra bilirubin. It says jaundice is common in newborns and usually results of an immature liver. They're more likely to be jaundiced when their Rh factor is different from that of the mother's. So if the mother has positive blood, baby has negative, or the other way around, then baby is more likely to be jaundiced. Infant jaundice is treated with phototherapy, and it helps to lower that. Hemophilia, this is another inherited disorder. It's something that people are born with. And it's where the blood does not clot. So usually they're missing a factor. You have several factors when you're talking about clot, the way that your blood clots if it's injured. If a blood vessel's injured, and they're numbered. So like factor 7 or factor 8. There's all these different ones. And so usually if people are missing one, they might be missing one or more of those factors. So, when I was working the emergency room, I had kids who would come in with hemophilia, and usually they'd maybe they were already sick, or maybe they noticed some bruising, or they'd just seen some other signs that they might be bleeding internally somewhere. The blood won't clot, so if they get a really bad bump or something like that, it doesn't just bruise and heal up and go away. It might just keep bleeding. And so we would give them whatever factor they were missing, then we would just give them that factor. You just inject that factor in, and it should help to cause the clotting that it needs to. Kind of a specialized treatment. It comes in this bottle, and you have to use a special needle, like this double needle. It's kind of strange. Polycythemia, what word do you hear in there?
Poly,
Which is
many.
many, cytocell, and emia is blood condition. So it means you have too many red blood cells.
So that's like the opposite of leukemia?
No, leukemia is abnormal condition of white blood cells. This would be like the opposite of anemia. So overproduction of red blood cells causes the blood to get really thick. People who live at high altitudes typically have this. Why is that?
The air is thin.
The air's
And they need to
thinner.
produce more red blood cells to get more oxygen.
Right. So they need more oxygen because there's not as much available. So their body produces more red blood cells so they can carry more oxygen at a time. And the treatment for it is basically like bloodletting.
Blood
Oh.
Well, it's not like when you go to the barber, like
Oh.
in the 1700s or the
Bloodletting.
1500s. Bloodletting. You just put in a needle, kind of like if you were doing a blood draw or something, and they would let out blood.
They just.
You weren't here for the history lesson in Principles of Health Science, right? Were you here for that?
I missed the first week of school.
Oh, well, you weren't for that.
I missed like the first
mine that I have.
Yeah, you would have missed it. It was like one of the first chapters we studied. Anyway, so polycythemia can cause thick blood. I know. I feel like you came like you weren't here for the first one. Leukemia, cancer of the blood. So leuko is white, emia is blood condition. So usually white blood cells is what the problem is. So acute lymphocytic anemia (ALL) is an overproduction of lymphocytes, which is a type of white blood cell. If you don't remember the types of white blood cells are in 10.1, I think you can look them up. Acute myeloid leukemia means you have too many myeloblasts. And remember that a blast cell, we talked about this. Yes, they build, right? Blast build. I'm trying to think of when we talked about it.
Those little things.
Osteoblast.
Yes, you're right. So myelo means bone marrow, or it can mean spinal cord. But here it means bone marrow. Do what? I'm guessing these purple ones may be lymphocytes.
Oh, it was blue to me. This picture does
Yeah,
it though.
I know. My projector sad. Chronic lymphocytic leukemia. So these are both chronic, long-term. They have a high number of lymphocytes. So CLL is rare in children. Usually have middle-aged adults. Oh, look at where it says myeloblasts. These are blast cells that later develop into red blood cells, platelets, or white blood cells. So they're like they're basically stem cells. Myeloblasts are. They haven't decided what they want to be when they grow up yet. And then chronic myeloid leukemia is where the bone marrow makes too many granulocytes. And if you go back to 336, you can see the different granulocytes. Basophils, eosinophils, and neutrophils are all of the granulocytes because they have granules. Makes sense. And then last one is multiple myeloma. This is where you actually get cancer in the plasma cells in the bone marrow. It can also damage the bone. It's the second most common blood cancer in the U.S. I'm guessing the first would be probably leukemia. I don't know. I don't see that on here. That would have been my guess, but anyways, said that myeloma deposits in the bone marrow, forming tumors that can damage the bone. As a result, people with multiple myeloma are prone to bone fractures and bone pain, particularly in the back and the ribs. And then other symptoms are high blood calcium levels, which makes sense because the bone's being broken down, so it releases calcium in the bloodstream. Kidney damage because of all the calcium in the bloodstream. And then frequent infections.
Not for you, Kyle.
There's some paper towels on the baking one. And that's it. That is it.
I
Yeah, this
feel
was a
old
pretty
already,
short
like-
chapter. Next chapter is a little longer. We'll spend a full 2 weeks on it for sure.
My bones hurt, Miss Bird.
What?
Bones.